Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I know we keep repeating key public health messages. It's because these measures continue to be very important to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 118,187 confirmed cases of COVID-19 in Canada and 39,628 cases in Ontario. Chatham-Kent has 299 cases, and Sarnia-Lambton has reported 319 cases. Michigan now has 84,707 cases, with 12,841 cases being in Detroit. Today, we are reporting 2,356 cases of COVID-19 in our community, an increase of 5 cases from yesterday. 1 case is in the agri-farm sector, 1 is a healthcare worker, 1 is travel-related, and 2 are from the community. 279 of our cases are currently active and are being followed by our health unit. 2,006 cases have now resolved. 260 people are self-isolating and 9 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home in COVID outbreak. In addition, there are 13 workplace outbreaks. 6 are in the agriculture sector, 6 are in the manufacturing sector, and 1 is in a construction workplace. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms that have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click on View Your Results to access the online test portal. If you are unable to view your results, please contact the assessment center or a healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again. During the month of March, at the beginning of the pandemic, many of the regular services of the health units were stopped and staff redeployed to support the COVID response. This included shutting down our Windsor and Leamington dental services to all but emergency visits, canceling more than 2,000 booked appointments, and ceasing all oral health screening for children and youth in school. Each year, the Windsor-Essex County Health Unit screens all JK, SK, and Grade 2 children in all publicly and privately funded elementary schools in Windsor and Essex region. In 2018 and 2019 school year, this screening included 14,793 children. School dental screening not only provides valuable information about the oral health of children and youth in our region, but also identifies children eligible for referral for further dental treatment and eligibility for Healthy Smile Ontario program. In the 2018-19 school year, 42.6% of children screened were identified as clinically eligible for the Healthy Smiles Ontario program. Poor oral health can affect sleep, eating, ability to learn, and lead to serious infection. Beginning in July, the Windsor-Essex County Health Unit reopened its dental offices in Windsor for all regular appointments Monday to Friday from 8:30 a.m. to 8 p.m. And beginning next week, the Leamington Dental Clinic will begin its reopening, rebooking, and seeing patients Monday to Friday from 8:30 a.m. to 4:30 p.m. The Windsor-Essex County Health Unit dental team provides preventative and routine dental services for children and youth ages 0 to 17 under provincially funded Healthy Smiles Ontario program, and for seniors 65 years and older under the Ontario Seniors Dental Care Program. Services under these two programs are free and include routine dental treatments such as x-rays, fillings, cleanings, and checkups. For seniors, the services also include coverage for dentures with a minor copay. Any family or senior already enrolled in Healthy Smiles Ontario or Ontario Seniors Dental Program were automatically renewed for the next benefit year due to COVID-19. To apply for the program, receive information, or book an appointment, call the Windsor-Essex County Health Unit at 519-258-2146, extension 1199. You can also access applications online by visiting our website at www.wcehu.org/your-health/dental. The oral health of residents is critically important to their overall health and well-being. Programs such as HSO and OSDCP can offer much-needed services to families and seniors that may be struggling financially, especially during this pandemic. I encourage parents and seniors to reach out to our oral health team for appropriate care. Thank you.
The conference is now unmuted.
We will now take questions from the media. Windsor.ca.
Not at the moment, thanks.
TBC.
Yes, Ms. Marentat, of the couple of the cases you mentioned today, was the healthcare worker local?
No.
The healthcare worker is someone who works in Michigan.
And the travel-related case, is there any details you can share about that one?
From Michigan as well.
Thank you so much.
Any questions?
Yes, I've gotten a few calls about people concerned about the mask policy, mostly just that they are being discriminated against, maybe not discriminated, so maybe that's the wrong word, but told they can't come into places because they're not wearing a mask, but because they do have a health condition. Would it be something the health unit would consider to kind of put those exemptions on all of the signage and things like that, to kind of let people know that there are exemptions to the rules so that people maybe feel more comfortable going into stores if they do have a health concern that they can't wear a mask?
So we have done this quite a few times in terms of educating the public and also educating the businesses with respect to the exemptions that are in the mask order. We'll look into it, that how we can make it more clear for the exemption piece in the signage, and how we can make it more, openly accessible information to everyone.
Thank you.
Any questions from AM 800?
Dr. Ahmed, just looking at Windsor Regional's website, and they have a section about the assessment center, total number of people swabbed. It's almost 22,000. Were you expecting numbers like that? Or is that what you're anticipating? Were you expecting higher, lower? Just your thoughts.
Well, I think the overall number when we are looking for our region, it's much more than that, so we do get our weekly data update from Public Health Ontario, and consistently, I think in the last 2-3 months, our numbers ranged anywhere between 4,500 to 6,000 every week. So overall number is significantly high. It's not just that number. And we do report all those numbers in our weekly summary, but I can tell you last week we tested more than 6,000 people overall.
So when it's more than 6,000, is that at the assessment center, that's at doctor's office, that's all over?
That includes everyone. So every specimen that's processed at Public Health Ontario lab or the London Health Sciences lab, we get that information back from Public Health Ontario, and that collates every test that's happened in the region.
Thank you.
Windsor Star?
Yes, good morning, Doctor. Does the health unit still plan to do screening of JKSK and grade 2 students during school year?
So I think we'll still have to see what the school reopening plan looks like and what options are available for us. We do want to mention that these services are still available. Screening, obviously, it provides us a more clear opportunity for referral, but individuals and families who qualify, they can also self-refer themselves to our services that are available. And they can come here as well at our health unit for a screening as well. If they want to go online and set up an appointment, come here and we can do the screening on site as well.
I guess if the health unit isn't able to do that screening in schools this year, is there a potential for kids' oral health to fall through the cracks? I know parents have the opportunity to take it upon themselves to bring kids to the health unit, but I assume some parents wouldn't do that without knowing the state of their kids' teeth through that screening. Absolutely,
and I think that's what the concern is, and we want to make sure that whatever we do, obviously it's not the business as usual anywhere in the world. It's COVID, it's pandemic, it's affecting everywhere, and we recognize the importance of it. So our services are available. We'll continue to look for creative ways to do that and to support the community in the best possible way.
Thank you.
Any questions from CTV?
Yes, Dr. Ahmed, I'm wondering if you reviewed the back-to-school plans from the local boards, and if so, what you think of them.
Well, we've had some preliminary conversation with the school board, and obviously we have provided them with our toolkit, and we'll continue to have that dialogue going. And again, we all recognize the importance of sending children to school for in-person education. But we also are aware some of the challenges that it will come across with especially with the class size, with the physical distancing, with the transportation, with everything that is needed to support our children. And we'll look into those plans. We'll provide our guidance, and we'll try to try to support our schools in the best possible way.
The Catholic Board is offering up a classroom today for media to have a look at and see, what a COVID classroom might look like. On that front, what were some of the recommendations from the health unit in terms of setting up classrooms for some of those restrictions?
Well, obviously because even every classroom could be different, every school will be different. So we are not getting down into the details and nitty-gritty aspects of everything. The key point is in a classroom, how you can physically distance children, where the teacher would deliver the lecture, how he or she will communicate with the children, what kind of process in place to ensure that if they are all coming in close contact or physically distance themselves at the time of the instructions and in breaks and in cohorts. So all those things are key, along with some of the administrative policies that many of these schools will have to implement, that about the screening, the responsibility, how their children are being transported to the schools and being picked up by children, the screening process to rule out any COVID-related symptoms. So all those things are being discussed right now, and the school boards are working on their plans, and we'll have an opportunity to have a conversation with myself and my team. So we'll be having all those detailed conversation, but not necessarily specific to the point of identifying any particular class or grade or school location, but it would be more broadly that given a size of the room, how many students can reasonably physically distance with themselves, and the process, the flow of student, the breaks, and all those details will be worked out.
And just one last one. I think you had made mention that you believe we will hear more from Premier Ford on stage 3 tomorrow. Do you have any new information on that regard? Are you still expecting some kind of an announcement regarding stage 3 tomorrow?
Well, I'm not sure if it happens tomorrow or if it happens typically on Monday. So I would be interested to hear from the province. Obviously, we will be providing some of the data, which we do typically on Thursday or Friday. So hoping that those data would help us to have a better conversation with the province in terms of what's happening in Windsor and Essex, and what are some of the key areas where we're continuing to see cases, and what are some of the risks that may that exist in our community if we move to a different stage, and what kind of an impact it would be. So all of those discussion will happen. I'm hopeful that with the data that we have, we'll have a better conversation, but I cannot commit that when the announcement will happen, either tomorrow or Monday. It's entirely up to the province.
Okay, thank you.
Any additional questions from Windsor-Essex.ca?
With the possible move to stage 3 soon, do you think we're ready, given that we've had quite a decrease in cases this week?
Well, I think it's what we need to recognize is still is as we are moving to different stages, it opens up more possibilities of exposure, but it also opens up more opportunities to alleviate some of the social and economic and mental well-being of everyone in the community. So I think we just need to find that right balance. So even, let's say, whenever we move to stage 3, I don't want people to think that everything is better now and they can return back to their life as normal. I would disagree with that life probably will not be normal, at least in the near future. How we can make it normal is by continuing to adapt to these public health measures with the new things opening, new businesses opening, new activities that we will engage in a safer manner. So I think it's just a matter of that. As a community, I think we have come a long way in terms of following all those public health measures and precautions, and I'm confident that our community will continue to do that when we move to stage 3, and we'll continue to follow all those measures to keep our community safe and keep our COVID case numbers down.
Thank you.
BBC?
No, thank you.
Blackburn?
No, thanks.
AM 800?
Dr. Ahmed, is the health unit investigating 2 additional deaths? The reason I'm asking is Windsor Regional's website, earlier this week it said they had 26 deaths in hospital. Now it's up to 28. Has there been 2 additional deaths?
So all I can say is Windsor Regional Hospital also have deaths that Windsor Regional Hospital also have patients from other parts of the region as well, outside of Windsor-Essex. And some of those deaths or some of those cases could be linked to them. From our perspective in Windsor-Essex, we do not have any new COVID-related death to report. We haven't received any information, and that's what we are reporting back to you.
Sorry, just a little confused there. So what's the difference if these individuals died in hospital because of COVID? Wouldn't that be in the health unit's numbers as well?
If they do not live in our region, they will not be in our list of reported death. If someone, whether they are living in, for example, if someone goes to Toronto but is a resident of ours and died as a result of COVID, it will still be counted as a death in Windsor-Essex as a result of COVID and not in Toronto. So similarly, if someone who lives outside of Windsor-Essex but hospitalized in Windsor and suffered any consequences, it will be counted as a number in that particular region and not in Windsor-Essex. I hope that clarifies.
So could we see, I guess, during this whole pandemic, when it comes to the number of people that passed away, the numbers would fluctuate then because of the point you just made?
No, I think the provincial number will stay the same, right? So it's just the regional number. And that's why I think it gets confusing when the hospital and they are reporting all these numbers, because they are obviously looking at their patient population. What we are reporting is on the residents who live in Windsor-Essex, and not necessarily who is in the hospital, where they're coming from, and they can be from different regions. So from a public health or from a regional perspective, we are focused on anyone who lives in Windsor-Essex.
Okay, thank you.
Any questions from Windsor Star?
No, thank you.
CTV?
Have a good day, everyone.
Thank you, everyone.